As of this week, I have posted lecture notes from last week's content onto the Canvas module for week 1. And in this video, I want to take a look at what kind of things you can expect to see on those notes, what kind of things you might not see, and how to best use them for learning in this class. So I do post the lecture notes after I've done the content. Part of that is because at the outset of the week, I'm not exactly sure how much material we're going to get through. And then also because of questions that come up via email and that sort of thing, there may be certain topics that I want to include in the notes that may or may not be covered in explicit detail in the videos. So the notes for the last week have 4 pages. It's a 4-page PDF that we're looking at right here. The first page is just some of the class format stuff that we covered, and so I'll jump right into actual course content. So if you remember, we talked about a couple different ideas. We talked about movement terminology last week. We talked about planes of motion. We talked about rotations in a plane. So these sets of notes go over the broad ideas that we discussed. So for example, how you might want to go through these is looking at the notes that you took during the video, comparing to the notes that I have here, reminding yourself why it's important to know this movement terminology, and then jumping right into recalling the important material. Like, for example, what is the anatomic position? You may remember I had a little stick figure drawn in what we had the anatomic position. Now, what was it about that? Well, it's just like standing up normal, but the palms are facing out, and the thumbs are facing out too. So maybe you draw that, or maybe you say thumbs are facing out, palms are facing forwards. And then down here, we went through those different terminologies for the different relational positions of the body. So we talked about anterior versus posterior, medial and lateral, distal, proximal, superficial, deep, inferior, and superior. So it might be to your benefit, and what I recommend you do, as I have here, is draw a stick figure down below and make yourself some illustrations. So for example, maybe you make a little stick figure like this, and we could give ourselves some arrows and say, okay, well, anterior, posterior, that's like forward and back. Maybe you label it anterior, posterior. Obviously, you'll probably want to do this in more detail when you do it yourself. Medial and lateral, we might draw our medial being towards the center line of the body. Maybe you do a little dashed line like this, medial, and maybe you make some note down here towards center line of the body. Lateral meaning away from that. And of course, that's this sort of like a mirror image on the other side, right? So this is medial, this is lateral. Maybe make some notes on that. Superficial, deep. Well, you might have to draw a different perspective. Maybe you draw a little diagram of, I don't know, like a cross-section of the foot, like you saw on the, or cross-section of the leg, like you saw in the comprehension quiz. Maybe you point out here, superficial is the outside, and then deep is further in. And then inferior, superior, maybe you get a different color or annotate it slightly differently. Hopefully remember inferior is further down, superior is further up. And taking the time to go through and do this will help you solidify what we learned in the previous week. Likewise, over here in planes of motion, we had those 3 planes of motion with a few alternative names for them. Again, I suggest drawing a little stick figure for yourself, or maybe more than a stick figure if you're better at illustrating. So just draw your 3 planes of motion. There's your sagittal plane. Here, there's your frontal plane. Here's your sagittal plane coming off like this. And then maybe you also draw your transverse plane. And then, of course, you label these with proper terms. Maybe there are alternatives also. And likewise for rotation in a plane. Something that maybe I didn't point out perfectly accurately or in the best detail last week was the fact that talking about an axis of rotation is equivalent to saying something rotates in a plane, and the plane in which something rotates in is going to be perpendicular to that axis of rotation. A good example of an axis of rotation is if you have a globe, like a globe of the Earth, and the line that it spins around, that's the axis of rotation. You could equivalently think about that as rotating in a plane, maybe oriented perpendicular to that axis of rotation. So maybe you draw some pictures like this, maybe you write in some notes clarifying that in some way that's intelligible for you, because of course these notes are for your benefit, not for mine. And likewise down here, you might draw a little stick figure or a little diagram maybe of knee flexion and extension. Maybe you draw like the hip and the knee and the foot, a little simple like this, in a plane. And you can, okay, well, it's going to rotate like this, and this is rotation in sagittal plane. So that's what I recommend doing for these notes. I'll try and include space for you to write your own or draw your own pictures, write your own notes for explicitly this reason. But if you want to do a quick review of the content that we covered in the previous week, these lecture notes that I'll post will be a good way to do that. So having covered that, we will jump right into the new content for this week, and I'll see you in the next video.